What is going on, everybody? We are back with another reaction video. Thank you so much for joining me today on this beautiful day. I hope you all are doing well today. And to all my new viewers stopping by, welcome to the family. Welcome to the family. I hope you all enjoyed this video today just as much as myself. Before we jump right into it, please feel free to like, comment, subscribe, and turn all post notifications on so you do not miss another one of these reaction videos. Now let's jump right into it, man. I'm really looking forward to this because you guys know how I feel about our healthcare system over here in the United States. It is very unfair, man. Very unfair. I know people that are 90. I know people that are 90 years old right now. I know people that are 95 years old right now. I know people that are in their hundreds. You think I'm exaggerating? I know people that are in their hundreds. Blessed to be in their hundreds right now. And they are struggling financially to pay off their healthcare debts. Are you serious? I mean, my goodness, man. I don't even want to go on one of my big rants today. Well, at least before we jump right into this video, I want to go ahead and get right into this video. I don't want to waste y'all time. Let's jump right into it. Today, I will be reacting to Americans in Canada share their healthcare stories. Wait, do these Americans share their past experiences they had with the U.S. healthcare system? Or are we talking specifically about Canada's healthcare system and how, it's different from the United States? Oh.
What do you think of when you imagine an American living in exile, unable to return to the U.S.?
Criminal,
Tax evader?
draft dodger,
Terrorist threat? Do you think of me?
Do you think of me?
Can't go home.
So I was living in California and I met my husband through some mutual friends and we fell in love and decided to get married. There was only...
Okay, so this is Kathleen. Kathleen is now self-employed. Good for you. Good for you. Kathleen is going to share... Kathleen. I tend to say Kathleen is the accent, man. Kathleen is going to share her story with us.
Only one small problem. He was Canadian. So we flipped a coin and we decided to live in Canada first. And here I am in beautiful British Columbia.
I'm originally from California, born in Los Angeles, grew up in Palo Alto. And I came to Canada in 1975 with my husband and my youngest daughter because he had been offered a fellowship at the University of British Columbia.
Boy, she dodged a big bullet, especially in today's time, because look at California now and the things that be going on over there. I would want to get out of there
When
too.
our son Sam turned 4, around the time he turned 4, he developed a rash on his body and he started to complain about his bones hurting. So we sent him to a dermatologist for the rash and a pediatrician for muscle weakness. And after some initial appointments, a dermatologist told us she suspected he had this rare skin and muscle disease called dermatomyositis.
Oh, man.
Without proper treatment, a third of children with dermatomyositis will die.
In Nanaimo.
Come on, I don't like hearing things like that. When people don't have an option, it's not fair. When people don't have a choice like that, it's not fair, man.
And I started having bleeding from the intestines, and it turned out to be a very, very rare autoimmune disorder, acquired type von Willebrand's, which nobody seems to know much about.
After she diagnosed him, it was only 6 days later when we were at Children's Hospital and they admitted us immediately. He had 4 days of intravenous steroid treatments, and we've spent the past 2 years, he's 6 years old now, slowly weaning him off of his medication while monitoring any disease activity.
Right.
So I had to retire early when I was 60. And from that point,
you had to retire early when you were 60 years old. I'm no genius, but okay, 60 years of age isn't that old. Now, 60 years of that age retiring? Are you serious? And guys, our country has been talking about raising it to 70 years old. Have you lost your...
On, has never been possible for me to go back to California because I knew I could never be covered by insurance there.
And you know that.
When Sam was first diagnosed, my friends in the States had one of two reactions. They either said, "Oh, are you coming down here for treatments?" Or they said, "Can you afford this?" And to me, both of those things seemed ridiculous. We've had amazing care in Canada. He has a team of pediatric rheumatologists that are world renowned. And the costs have been a non-issue. We simply pay our monthly payment of $108 a month, and we march in. We don't fill in any paperwork for him to see the doctors, and it's all good.
Woo! And I'm hearing that you guys get to skip the paperwork. Oh man, them nurses. It's not the nurses. I don't get aggravated with the nurses. It be the men. It be the men doctor, the male doctors that want to come. Oh, you need to relax. The security guards don't even be tripping as much as the male doctors. I'm like, man, you better back up. My family member in need right now, man. You handed me some paperwork. You better back up. Now's not the time to mess with me, man. Several times, guys. I've shared this story so many times when I've had to rush family members to the hospital. Could you give out this paperwork? Could you do this? Can I get a wheelchair? Can I get a seat? Can I get a something? My goodness, can I get a something else? You handed me paperwork. Give me something else. Something that's beneficial right now. Not my insurance information. Who's your insurance provider?
There is something
annoying.
that was discovered fairly recently called Factor 7, and time before last, when I was in the hospital here, they gave me that, and it seemed to work. The interesting thing is that the Factor 7, I don't know exactly because I never get a bill for anything, but
must be
I
nice.
was told that it was about $60,000 a dose, and I was given 4 or 5 doses in the hospital. And the interesting thing to me...
That's $300,000. Yo, 60,000. Did I hear that right? 60,000? Did I hear that right?
I don't know exactly because I never get a bill for anything, but I was told that it was about $60,000 a dose, and I was given 4 or 5 doses in the hospital. And the interesting thing to me is that I have never been told that I couldn't receive a treatment here because of the cost of it. I don't even know the cost of these things.
When I was researching the costs of healthcare in the U.S.,
and this is why we need to pay taxes. This is why we need to pay taxes, okay? Because obviously this taxing the richer thing, taxing the richer more, it ain't working out. It obviously ain't working because they ain't paying enough. They ain't paying enough. They making enough. Charge us all more monthly for taxes. Charge us all more monthly for our taxes so that we can have a fair healthcare system like this. It's not that hard. What's up? Strac for mayor. Something. Strac for mayor. Something. I mean, because this is ridiculous. I'm making changes like this. Beneficial changes for my country. Not starting wars. Starting controversy with other countries.
I asked some other Americans on a message board about his disease, what the costs have been to them. And that's when I discovered that our out-of-pocket costs for care would be between $45,000 and $165,000 for 6 months of treatment. I realize I have no idea what the costs have been in Canada for his treatment because we've never seen a bill.
Yeah, I would like to spend whatever time I have left, my remaining years, closer to my children and grandchildren. And I certainly can't do that under the circumstances with the present healthcare situation in the U.S.
I'm sorry for pausing so much, guys. This video is really triggering me, man. It's too relatable. Charge you all that money, $45,000 to $100 something thousand. You gonna be paying that off for the rest of your life. Some people in this country, most people in this world don't even make that average of 6 figures from their jobs. They don't even make that as a salary. So how you expecting them to pay this off, or, you know, being able to give you a lump sum of money right away, or just being able to pay it off in the future? Like, are you crazy? When I used to work in the supermarkets, when I used to work at Walmart, the older people used to share their stories with me about, you know, why they are basically still working at Walmart. Why they basically had to come in and do a 9 to 5 with me. I'm like, what's going on? No, put that down. I'll do it for you. I was running around doing everything for everybody. Let me do it for you. Rest. Just relax and just stand here at the self-checkout, please. Let me do it. Let me hop on the register, man, because they don't care. We got elderly people busting their behinds at these jobs on a 9 to 5 schedule because they can't afford the healthcare benefits, or they need to pay it off. They still have some healthcare debts. Maybe some debts from past surgeries or upcoming surgeries, because, you know, things start to change with our bodies as we get older. Things that we can't control anymore. And it really is, you know, a letdown. I've heard too many stories from elderly women about how they gave all their money, like sacrificed it all. I mean, like every penny to the last. They would give the socks off their feet if they could towards the payment, man. To saving their kids, saving their spouse from passing away because they needed to cover the costs in order for them to get these medical treatments in order to cure themselves. And then come to find out a few years later, their kids or their spouses still ended up passing away. So now you're stuck in a financial burden. And now you're mentally depressed at the same time, because it's like, I gave my whole life to save this person, a person that I truly love and care for, and I still lost them, and I lost my life. I lost my career, I lost my earnings, my future, I lost it all. It's sad hearing those stories, man.
I'm interested in moving back to the U.S. because I miss my family, and I want my child to be raised near his grandparents and his aunts and uncles. And I also just miss my country. I began to investigate what it would take to move back to the States, and I immediately thought of healthcare as a concern because of Sam. And I called a number of private insurance companies and was told outright that we would be denied coverage based on his pre-existing condition. I then looked into what government programs were available, and the S-CHIP program has an income cap of $45,000 a year,
enough.
and we exceed that.
So what I have is
enough.
disability, social
That's the
security.
minimum for them.
And they wrote me a letter and said, don't ever bother to apply for Medicare because you are not eligible.
They better not have started off the letter like that. They better not have started off like that. Because let me tell you something, ma'am. Us two, we'll be at that front door, or whatever door to their business or their home. Hey, we gonna be there knocking. Don't you be sending crazy emails like this, man. If she can't get approved for it, at least break it down in a reasonable way. In a respectful way that, you know, she can take. Because this is a lot for somebody to hear. What do you mean you can't cover me? And this is exactly why they got to go out and get jobs.
Worry if my mom's cancer came back, I couldn't go down there and care for her and see her live out her final days.
As an American citizen, it seems to me that I should have a right to spend my last remaining years back in my home country with my children and grandchildren.
With freedom.
Living in a country which has universal coverage, I've experienced both systems, and the system in the U.S. is not fair for middle-income people or for low-income people.
I'm just going to be extremely disappointed in the American system and the way that it works, and the people in Congress.
To me, healthcare, it's a human right. It's not a privilege.
Well, land of the dollar. That's what I like to call it. This is the land, the home of the dollar, okay? You ain't gonna get much for your dollar over here. If you guys enjoyed this amazing video just as much as myself, please feel free to like, comment, subscribe, and turn all post notifications on so you don't miss another one of these reaction videos. And please feel free to share any personal stories if you are comfortable with it. If you guys are 100% comfortable with sharing, I would like to hear everyone's personal experience, personal healthcare experiences in the comments down below, whether it was with the United States or Canada, or with a loved one, yourself, or a friend, or your children. I'm curious. Thank you so much, everybody, for stopping by to watch this amazing video with me about Americans in Canada sharing their healthcare stories. I'll catch you guys in the next one. Stay safe.